Good afternoon, everyone. My topic is dry eyes in diabetes mellitus patients and its association with diabetic retinopathy. Diabetic retinopathy stands as a marker of generalized microvascular disease, while corneal neuropathy acts as a tool to predict peripheral and autonomic neuropathy and hence gives an opportunity for early treatment. Diabetic complications have been recognized in cornea as indicated by alterations of immune cells in cornea. It causes decrease in tear secretion, corneal sensitivity, and poor adhesion of regenerating epithelial cells. So the present study was undertaken to evaluate corneal surface in diabetic individuals and risk factors attributable to dry eye. And furthermore, an attempt was made to find any correlation between diabetic retinopathy and dry eyes. So this was a cross-section hospital-based study which included 150 patients for a period of 18 months. All patients of either sex and all age groups diagnosed to have diabetes of any duration were included. Patients with local disease and systemic diseases like other than diabetes mellitus, which are known to cause other ocular surface abnormalities. Patients on local or systemic medication, which are known to cause other ocular surface disorders. Chronic contact lens users, and history of previous ocular surgeries. These patients were excluded. So after taking an informed consent, detailed history, which included a questionnaire about dry eye, and a detailed ocular evaluation was performed, and an anti-segment examination under slit lamp was included, which included meibomian gland status, corneal sensation, tear meniscus height, tear breakup time, fluorescein staining, and Sherman's test was performed. Fundus examination with both IDEO and 90D slit lamp biomicroscopy was done, and retinopathy was classified into mild, moderate, severe NPDR and proliferated diabetic retinopathy. Dry eye was graded into 3 types: mild, moderate, and severe, which was based on Sherman's test, TBOT, and corneal staining. So the results included a total of 150 diabetic patients, which had 50 patients were type 1 diabetic and 100 patients were type 2 diabetic. Majority of the patients were in the range of 11 to 20 years in type 1 diabetic age group, and while majority of type 2 patients were in the age group of 51 to 60 years. So the total prevalence in type 1 diabetic patients was 32% of dry eyes, and type 2 had 38%. Total prevalence of dry eyes in these diabetic patients was 36%. The statistically significant correlation seen in dry eyes and diabetic patients was with fasting blood sugar and postprandial blood sugar, which was less than 0.01% significant, which was showing that there's an association of glycemic control with dry eyes. Then in risk factors which was prevalent in diabetic population with associated dry eyes, it was mostly seen in patients with meibomitis and reduced corneal sensation. As we can see here, the p-value was less than 0.01% in both these categories, with an odds ratio of 6.57 and 21.31 in respectively in meibomitis and reduced corneal sensation. Again, coming on to the test, we had 32% of the patients had abnormal TBOT, 22% had Sherman's test abnormal, and 19.3% had Sherman's test with anesthesia abnormal, and fluorescein testing was 20% abnormal in these patients. Overall, there was no statistically significant correlation between retinopathy except in cases of high-risk PDR. But again, there was only 1% of one patient with high-risk PDR, so we cannot be. It was statistically significant, but we cannot really interfere that it was statistically significant that way overall. So my conclusion is that poor glycemic control was associated with 1.91% times increased. Showed increased risk of dry eye. Other significant risk factors included hypertension and prior laser treatment. Reduced corneal sensation and meibomitis are also major risk factors. Abnormal TBOT was present in 32% of patients, while decreased tear secretion and basal secretion was noted in 22% and 19.3% respectively. A statistically significant association was found between high-risk PDR and dry eyes. But the limitation of my study is that it was a small sample size of 150 patients. Thank you. The time period was a little concise for me, so and I could not get really patients with who had a good follow-up. So that is why we had patients lost to follow-up, and I could not include them in my study. That's why I had a small sample size.
What is the mechanism of dry eye in diabetic patients?
So it can be because of hyperglycemia, it can be because of insulin deficiency, and it can also be because of inflammation. All these 3 factors can lead to dry eyes. So the key factor is insulin deficiency only. हाँ जी sir.
Because they develop hypoanesthesia.
Yes sir. So hyperglycemia. Because of hyperglycemia that leads to neuropathy.
हाँ, so neuropathy क्यों
Yeah.
होता है? So if you understand why the neuropathy, then you probably won't take at this corneal anesthesia
Yes, sir.
as a risk factor. Or
Yes, sir.
statute,
Yes,
because
sir.
they're the same mechanism.
That is the same mechanism. Right, sir.
All right.
Okay.
Thank you.
Thank you, sir.